you know who answers when you dial 244-9090? Hello, I'm Bill Kimball, and that number puts you in touch with a member of the staff of the Visiting Nurses Service, and their headquarters is located at 500 East Avenue. This nonprofit health organization was established in 1919 during a national influenza epidemic, and it has been serving the health needs of the public ever since that time. But let's find out more about this organization and the services they perform. Let's go inside.
Do you need any catheters? No, I have one. It's enough for today. Do you need any syringes? No, I have enough. Okay.
Visiting nurse service.
Physical therapy, Mr. Lufano.
The VNS moved from Spring Street to its present home in 1949. As you can see, this present building is beginning to bulge at the seams as the number of services offered has increased. The founding principles of providing mental and physical health care for the individual, family, and community, preventing disease and disability by teaching the principles of health, and providing aid in the rehabilitation of individuals and families through such functions as public health nursing, physical therapy, and allied disciplines are carried out by the administrative staff, volunteers, and others who make up this organization. What makes the VNS different from so many other health services? The most unique feature is that it provides the in-home service. It brings its services to the patient in his own home, making it possible for some patients to receive care at home who might otherwise have to be in a nursing home or a hospital. This can be especially important for the elderly who live alone or reside in a family in which all the other members work at an employment outside of the home. The three major areas of health care are the Professional Home Visiting Program, the Visiting Health Aid Program, and the Meals on Wheels program. Let's examine these more closely. The Professional Home Visiting Program provides professional nursing care by registered nurses as prescribed by your doctor. Your visiting nurse keeps your doctor informed of your progress, may teach you or members of your family how to continue the care and or arrange for other medical or social services for you or members of your family. These visits are normally made between the hours of 8 a.m. to 4 p.m. Monday through Friday, and on weekends and holidays by special arrangement. A request for a visit may be made by you, your family, or your doctor.
Hello, doctor. This is the visiting nurse, Miss Abby, and I was calling in regards to your patient, Mrs. Jones, and I just wanted to report that her neck wound is still having a moderate amount of drainage with scant blood, and I will keep you informed of any progress that she makes. Okay, thank you very much. Bye-bye now.
There's quite a few.
Another service offered under this program is provided by a professional physical therapist. This therapist can help your recovery from an illness or injury that has left you or a member of your family physically impaired. This service is provided by a referral from your doctor and is given in your home for those who cannot get to a physical therapy center. A speech pathologist is also available to assist you in overcoming speech problems after an illness, injury, or surgery. This person is also trained in teaching you how to communicate with others when you have suffered a hearing loss.
Sometimes if we spell it, it helps. Sometimes, George, if we see it written. Let's see if it helps this time.
Ford.
Ford. Ford is the name of a
Car.
she broke a
Dish.
I'm going to wash the...
Dishes.
She's a good-looking...
Nurse.
dish.
Dish.
All right, let's go for plate now.
The program also offers help to you in planning special diets and balanced meals. This service is provided by a trained nutritionist from our staff.
How would you be able to tell the 3 meat exchanges?
Okay, on the palm of a woman's hand is about 3 inches by 3 inches by ½ an inch. That's 3 meat exchanges, or 3 ounces. So it's a real easy way for a woman, who usually does the servings anyway, to judge it. Yeah, do the pot roast, same way with the liver. Real easy. Could go on.
Lastly, the program offers the services of a mental health consultant. This consultant is available to the staff and you through your visiting nurse when discharged psychiatric patients are involved, or may simply help you with the stress that occurs within families where a serious illness is involved. The Visiting Health Aid program provides someone to care for you during the day. This person gives you the kind of care you could expect from a member of your family. The aide has been employed and trained by us to provide you with assistance such as bathing, moving from bed to a chair, practicing your therapy exercise, bed making and tidying up your home. This aide works directly under the supervision of a professional nurse. The nurse confers with your doctor about your need for an aide and the care which the aide will provide. Visits by health aides normally last 3 or more hours and are continued until you have recovered sufficiently to care for yourself or a member of the family can take over. The first Meals on Wheels program originated in Philadelphia. The second was founded in 1958 here in Rochester. This kitchen was added on to 500 East Avenue. And the Meals on Wheels program was the first in the country to be medically oriented. Even today, more than 40% of the daily meals produced in it are special diets. The food is prepared by our staff under the supervision of a nutritionist. The deliveries consist of 1 hot meal for noontime and a cold meal which can be kept in the refrigerator and used in the evening. Disposable containers are used for the entrees. After the food has been packaged, it is placed in either these insulated boxes which keep certain food cold, or these electrically heated containers that keep the hot meals warm. Over 200 plus volunteers assist us in this program. These volunteers are broken into teams of 2 persons each, a driver and a server.
Here you are, Tim. Car number 4. Everybody's the same but Mrs. Jones, and she's a special today.
Okay,
See you when you get back. Bye now.
Each team delivers 8 to 12 meals a day, 5 days a week. A different team is assigned to each route each day. This team is responsible for ensuring that the proper diet is delivered to the right person. The meals are delivered to those who have no one else to prepare them, but who are able to obtain weekend and holiday meals from their families and friends. There are other services also being offered. Personalized home support service is provided by field staff workers who act as patient advocates, particularly for the elderly. They arrange for medical services outside the patient's home, such as eye, dental, or hearing appointments, and ensure that these patients have transportation to and from these appointments. Their responsibilities also encompass the locating of housekeepers, companions, and cleaning persons for people with medically related problems. The last program we shall look at is the rental of medical equipment and supplies. This area supplies the logistical backup for the nurses and patients in other programs. Equipment such as walkers, wheelchairs, and other items for the sick room are rented to you on a cost basis upon your doctor's prescription. With me is Miss Ada Davis, who is director of the Rochester VNS since 1965. Tell us, Ada, how are the payments and fees derived for the services performed?
Well, fees are based on the cost of each service that we provide. And the fee that we charge just covers that cost. There's no profit involved. If a family cannot afford the full cost of the service, then we adjust the fee downward to an appropriate amount, and the difference is made up by the funds that we receive from the United Community Chest. Most of the support of the agency comes from patients' private or government insurance, such as Medicare, Medicaid, Veterans Administration payment, Blue Cross, PIP, and so on.
Well, tell me, is there any controlling factors involved over the overall service and system?
Well, we're what's called an approved home health agency, and that means that we are licensed by the state of New York. They visit the agency annually, and we're required to meet rather rigid specifications that they have set up for home health agencies. Then, of course, in addition, our board of directors is the policy-making board for the agency, and there are various committees, such as their medical advisory committee, professional advisory committee, are closely involved in monitoring the work that the agency does.
Well, Ada, thank you very much for answering our questions. And if you have any questions concerning the Rochester Monroe County VNS, call 244-9090. A member of our staff would be more than happy to answer any inquiry.